Let me add one other thing about the federal government. I don't understand the CDC's instructions here and how they think that this is supposed to work. The CDC says basically anyone who thinks they need a test should go to their doctor and ask for a test. The Vice President says we don't have enough testing capacity to address all the tests that we need to take. You cannot square those two statements. If the Vice President says we don't have sufficient testing capacity, then how are you inviting anyone who thinks they may need a test to go ask for a test? How can you be bringing more people into the pipeline than you can address at the end of the pipeline? How are you doing carte blanche? If you think you need a test, go to your doctor and then you can get a test. By the way, I can't do enough tests. It does not work. It does not work. You can't manage a public health care situation that way. You know your capacity on how many tests you can do. Prioritize the need for the test to your capacity. If you can only do 100,000 tests, then prioritize the 100,000 people coming in for the test. That's what we're doing. We're calibrating, prioritizing the tests to our capacity. As the capacity grows, then you can change the prioritization. But their position is absurd and nonsensical. We can't do enough tests. Anybody who needs a test, go ask for a test. And go talk to your doctor, and if the doctor says you should have a test, you can have a test. That is not only bad government and poor planning, it will increase the fear. Because then people will be showing up for a test, and the doctor will say, well, I know you heard that, but actually we don't have the capacity for the test. Or they'll take a sample, and you won't get the results for a prolonged period of time because they don't have the capacity to run the test. You know, there's two pieces. You can take a sample, but then you have to have the test run. So to me, that is not only on its face nonsensical, it will only raise the anxiety, which I believe is premised on hype to begin with. But now you compound the anxiety with a confusing and incorrect governmental response. And in a situation like this, Rule 101 is government is there to help and show that it's competent to increase confidence. When are people confident? When will people relax? When they know the information they're getting is true and there is a competent response.
Are you concerned about having enough tests here in New York?
Well, look, we have said from day one that we're increasing testing capacity. Our goal is to get to 1,000. Now, the CDC, I believe, was slow in authorizing the states to test in the first place, right? Their first position was we have to do all the tests. They have to go through Atlanta. Then they, in a tardy fashion, shifted, okay, the states can test. That then allowed us to test. We then asked for capacity to use private labs to supplement our capacity with private labs. They were slow, CDC was slow to approve the use of private labs. They have approved private labs. We're now contracting with private laboratories. And we want to get our capacity to 1,000. But what you have to do along the way, Joe, is calibrate your priorities to your capacity. If we can only do 500 tests per day, then you want to make sure you're doing the right 500 tests, which are the highest priority. You can't put up an entrance sign that says, anybody wants a test, call your doctor, enter here, if you don't have an exit. You can't bring more supply into the pipe then you can get out of the pipe.
You don't have that number yet, like you don't know that you can't do without, you say maybe
We have our priorities, and we can handle, we have the capacity to handle the priorities we established.
What's our capacity?
About 500 per day.
And then, have you declared formally a disaster related to this? I know Governor Hogan in Maryland did, and we passed the bill Monday, but did you formally declare a disaster? And if not, when? What's the fact?
We are operating through the emergency management system. Inherent is that, in that is the declaration of emergency. I don't know that I separately declared an emergency.
Is there a possibility of a legislative session, and do you think the budget?
I think this is months. I think the anxiety and the fear is more of a problem than the virus. I think I'm sorry? Oh, I'm sorry. Did you say disrupt? I thought you meant go through. I think it'll continue 4 months. No, we have other things to do. I'm going to work. I'm going to, when I work overtime, I get double pay. So.
Is there a possibility that this building or other parts of state government will be shut down if this gets worse?
The LCA is going to be shut down. I understood. Mandatory quarantine.
Governor.
Gormley. Yes.
If I may. Can you explain what's going on in Long Island as far as how many troops are out there, how many of these health detectives are out there, what you're doing? Is there anything different about the process there? Or just describe how you're dealing with the
We had a meeting yesterday. We met with the county executives. We met with all the local health officials. Northwell, Michael Dowling, who's tremendous. You used to work with my father. He was Deputy Secretary for Health and Human Services, just an amazing human being. Northwell has tremendous testing capacity. Now that the CDC has authorized us to go to other labs, Northwell is going to be one of those labs that will be doing testing, and he has significant testing capacity. Stony Brook was there. That'll also be doing testing capacity. We're working well with them. I don't think there was anything different that came up yesterday.
But do you have an idea how many people are out there trying to get the contacts that this person had at this point?
All the employees of the Nassau County Department of Health. I mean, they are the prime investigatory mechanism on the ground.
Do you know what you've expended so far? Has there been a measure of that? When you say the $40 million and the money coming in, I don't even know how you quantify it, but do you have an idea of how much you spent?
I could ask budget, but it's not just our number. It's going to be the local health departments also.
Do you have to adjust the revenue picture sometime in the short term here because of the stock market and what this is going to mean? I mean, nobody relies more on the stock market than New York,
Well, we are more,
revenue.
we're more bonuses, financial bonuses, but nobody knows, right? I mean, if we knew what the financial impact was going to be 2 weeks down the road, 2 months down the road, we'd all be in a different job. Yes.
Is there any other additional information on whether this might be seasonal, doctor, that it might change when things get warmer?
No, nothing yet. We're still watching.
For 5 people you said are hospitalized, I believe you said 5. Can you say what their conditions are and where they're hospitalized?
That would be revealing too much information about the patient specifically.
TMI.
Can you say critical or not? Yesterday you said critical and stable.
Well, on that one, which was the first case, but everyone is from what I've heard, and I'll follow up on that, people are doing well. People are doing well.
Does anyone have anything else to add?
I would just add to the question earlier on the communication with the local governments. It has been an unprecedented level of communication with the local governments. Everyone at this table, from the governor on down, has been in direct communication with the county executives, the mayors, the head of the health departments, and everyone around the state is really pulling together to make sure that we're bringing all the resources to bear to confront this. And it's been amazing to see.
Quarantine of 1,000 people. A lot of those are members of that temple. Have you had any conversations with them and just making sure that community is getting the care and the response that it needs?
Yes, extensive. We've had many conversations with many individuals. I have. I know the doctor has. I know Melissa has.
Think about that as a community and as an organization. That the rabbi announced that he has it. How their resilience through this.
Look, they've been very cooperative. We had a meeting with them, actually. They wanted to know what the right precautions were, but they were very cooperative. Look, I think everybody is a little nervous, right? I hear it from people on the street. I hear it from random people. I hear it from my family members. They're nervous. They're nervous. Everybody has different opinions, and all this politics overlays this. And that's why I keep pushing just the facts. If you know the facts, Joe, you will not be nervous. If you know the facts. But you have to separate the hype from the facts. I think the more time goes on and the more facts they have, the better. Right? The more you can say, we have 33 cases. Okay, so what? 5 are in the hospital. Only 5? Yeah, only 5. Well, I thought this was coronavirus. Yeah, I know. It is coronavirus. Only 5 are in the hospital. Oh, how many have died? None have died. Where is it most serious? It's most serious for senior citizens, like the flu. More people are dying of the flu than coronavirus.
Governor, do you take actions against people who are thought to be against people of Jewish persuasion, of Asian descent, because of this flu? Are you hearing many
It's something I watch for. I haven't seen it or heard it. No, and Melissa's point before, look, there's nobody better to step up in a crisis than New Yorkers. These local health departments have never handled this before. Never. You know, on the statewide level, state government, we do statewide emergencies. These local health departments have never done it before. The temple we were at, the SAR school, the other schools, they're amped up, but all cooperative.
Precautions that the state is urging some of these communities to take with the Jewish holidays early next week, where a lot of people will probably be seeing each other and convening.
So we've been working with the community about that and recognize that that's one of the key points that they have raised. And it goes back to the issue of making sure those who have been exposed are aware of it, that we have them in quarantine, and that all of these specific cases we track back as fast as possible.
By the way, part of this anxiety, one of the things we've heard from healthcare professionals, there have been thefts of medical equipment and masks from hospitals, believe it or not. Not just people taking a couple or 3, I mean just actual thefts of those products. I've asked the state police to do an investigation, look at marketplaces that are selling masks, et cetera, medical equipment, protective wear, playing into this, exploiting the anxiety. There's also a price gouging component, and I'm going to ask the Attorney General to do an investigation on price gouging. So, it's one of the consequences of the anxiety. Okay, thank you.